This now on our nation's battle against the coronavirus pandemic. U.S. Surgeon General Vice Admiral Jerome Adams joins us live.
Dr. Adams, it's an honor to have you on the program. Thanks for joining us.
Well, great to be here. I just heard that great weather report, and I want to remind people that one way to stay safe this Christmas is to have your gathering outdoors, keep it within the people of your household. Understand that there are measures that we can take right now, even as we wait to get our vaccines. And hopefully you all saw me get my vaccine live on TV.
Yes, sir.
Last week.
There's a headline that many of us are waking up to in the LA Times this morning that reads, "We're going to be New York. LA hospitals brace for the worst." People in LA have largely followed the rules. Even as other parts of the country mocked masked or social distancing, we've had the shutdowns. We've done the right thing, or so we thought. Yet we have become one of the epicenters of this pandemic. Is there an explanation as to why?
Absolutely. This virus is incredibly unforgiving. It is much more contagious than scientists originally thought. And the dynamics of disease spread are changing. People are doing the right thing. They're not gathering in public as much as they used to. But unfortunately, that means they're gathering in homes. And 50% or more of people, according to the CDC, are spreading this virus asymptomatically without ever knowing that they're sick. And so that means that when you have a gathering beyond the people in your household, you're increasing the chances that you're bringing in the virus, that you're spreading the virus. That's why we need to be vigilant this holiday season. But we also need to understand there are measures that we can take to get us to the finish line, which is now in sight with 2 vaccines. Wash our hands, wear a mask, watch our distance, especially with people outside of our household, and wait on these holiday gatherings. And right now, you can help us with this surge by donating COVID convalescent plasma. I put out a call to action today, calling on the 15 million people plus in this country who've recovered from COVID-19 to go to thefightisinus.org and find out how you can donate your plasma, which contains a secret weapon, antibodies against the virus, that can help other people survive and can help relieve that strain on our healthcare system.
Right, and that effort is called The Fight Is In Us, asking people that have already gone through COVID-19 and have recovered to donate that plasma, and that helps people that are now suffering from it to get better. Another question we wanted to ask you here in Los Angeles, U.S. Navy sailed the hospital ship Mercy into LA waters to help if our ICUs became full. That happened back in the spring. They are now full. Is there any consideration to bring the hospital ship back to help?
Well, that's always a consideration. We're going to have a task force meeting this afternoon. And what I want people to understand is this surge is different. The first 2 surges we had were regional, and we were able to deploy resources from place A to place B. This current surge is hitting everywhere all at once, and it's why we need everyone to be particularly vigilant. But this surge is different in a good way. And the good of it is that we have vaccines. We are starting to vaccinate the vulnerable. We're starting to vaccinate healthcare workers. A finish line is in sight. And the hardest part of a marathon are the last couple of miles. But if you can see that finish line around the bend, then you'll have the strength to keep going. I want you to have the strength to keep going. Go to thefightisinus.org. Get your vaccine when your vaccine is available, with the knowledge that it won't be for several weeks for most people. So we still have to take measures today. And follow those W's. Wear a mask, wash your hands, watch your distance, and wait on these holiday gatherings. That's how we get everyone to the finish line, LA.
And we're going to put information on the screen at the end of this conversation about how people can get involved in the fight is in us, because it is so important. I want to ask you about this new, more contagious strain of coronavirus in the UK. Is this something we should be concerned about here in the U.S.? Other countries have imposed a travel ban on travelers coming out of the UK into their countries. Should we be considering a travel ban on travelers coming to the U.S. from the UK?
Well, we're going to have a task force meeting in just a few hours to talk about this very issue. And we need to let the science lead the way. So what I want people to know is I talked to the head of the National Institutes of Health, Dr. Francis Collins, and here's what he told me that just this morning. Viruses mutate all the time. This is nothing new. The virus which causes COVID, SARS-CoV-2, has mutated dozens of times this year. That doesn't mean that it has become more deadly or more contagious. So we're going to study this with the WHO and other groups out there. But the important point really for people to remember is that this just underscores the importance of taking these measures now. Good news is that so far it doesn't seem like this is going to affect the ability of vaccines to work. But even if they do down the road, it'll be just like the seasonal flu vaccine. We know how to change it. We know how to deal with this. Vaccinations are still going to be incredibly important for ending this pandemic, but we need to take the measures now to slow the spread, especially with the potential for a new, more contagious variant. The same old public health measures still hold and still work.
We so appreciate you and your time this morning. We want to let everyone know once again that fight is in us. That's that national effort that you're spearheading about convalescent plasma during the pandemic. I want to let folks know that they can donate plasma if they have been through COVID and are now on the other side of it to help those who are still suffering.
Can I ask a question about that, Vice Admiral? Is it something that we know works, or is it something we're still studying? And if I have antibodies, am I definitely going to save someone else's life?
Well, what we know from the studies is that when we give it early, within the first 3 days, it has the best chance of helping prevent someone from going from being in a regular hospital bed to an ICU or worse. Some really good studies out there. We're trying to figure out how to best utilize it. And the other thing for people to know is if you have a high level of antibodies, that can be given directly to someone to help them. If you have a lower level, we're still using that plasma to make other medications and to do studies. So your plasma will not be wasted. And going back to the vaccine, since we're talking to LA, I just want to give a shout out to Mayor Garcetti. He's a buddy of mine, and I know he's working hard to keep you all safe. And LeBron James, I know you've been a big supporter of masks. I want to know when you're going to take the shot, not the basketball shot, but the COVID shot, because I did it because I know it's safe, and we want to make sure people understand this is how we end the pandemic. And while we wait to end the pandemic, we do our part by donating plasma if we've recovered and following the W's. Wear a mask, wash your hands, watch your distance, and wait on these holiday gatherings.
Dr. Adams, have you reached out directly to LeBron James in another way, and are you just waiting for his response?
Well, you know, I would love to say that I have LeBron James' cell phone number. I've actually gotten a lot of people's cell phone numbers throughout this. Steve Harvey and I are back and forth. Jose Andres, he and I have worked a lot to help the Hispanic and Latino communities who've been hard hit by this virus understand how they can stay safe. And Oprah and I, you know, we're working to help keep the African-American community safe. But I don't have LeBron's number yet. And I'm messing with him because I was in Ohio this weekend, and they're the ones who told me to ask him if he was going to take the shot. But I think that's how we promote confidence, and we want people to lead by example.
And you have Oprah's number, so I mean...
Come on. We can make this happen, Dr. Adams. Let's make this happen.
And if LeBron's watching, you know, maybe you'll hear from him.
Yep, take the shot, LeBron, take the shot. And encourage people to go to thefightisisus.org, LeBron, and give plasma if they've already donated. That's how they can save a life this holiday season.
All right, U.S. Surgeon General Vice Admiral Adams, thank you so much. Wish you a Merry Christmas as well. Thanks for your time.
And there's the information on the screen about thefightisisus.org.